strange because you go from completely able to do something to completely able to not, and it's just over and over and over and over and over. So it's like having a stroke over and over again. And so it's unbalancing, you know.
Mm-hmm.
I have like the sixth sense. My body does some weird
Huh.
things. Like I get some tingles in my head, or my eye will start to tingle, like very specifically. And I was like, I think something's coming. So I told my husband this morning or yesterday morning, and I said, hey, just a heads up, for the last 2 days, I've kind of been getting these little warning signs that I'm probably going to have a pretty serious attack. I said, I'm just letting you know. That way you're not freaking out when it happens or anything like that. He's like, okay.
Yes, Xavier, you were in a car accident on April 1st, 2004. It took 5 years to get properly diagnosed with migraine with Brainstem Aura, Hemiplegic Migraine, Vestibular Migraine, Retinal Migraine, and new daily persistent headaches. So before the accident, were you just diagnosed with regular migraines and then the accident exacerbated your symptoms, or what happened?
I either have to use my right arm and pick it up and put it in the car, or somebody
Mm-hmm.
does it for me. So it's things like that. But I also have the severe pain. So I have the muscle weakness, but not the paralyzation. So it's really weird because mine's a
Huh.
little bit different than a typical hemiplegic migraine patient.
So, like, according to Matthew McConaughey, you're all right, all right, all right.
Yeah, sometimes. Because there's something called migraine hangover, and the hangover is really rough. It's almost as rough as the actual migraine. So even though you have a migraine for 24 hours, the next 24 hours you're in the hangover phase and you're recuperating, and it feels like a hangover. And it's funny enough, like the things that cure hangovers are what we do during our hangover period after a migraine. Yeah,
Yeah,
it's a
so it's,
it's a lot. And if you're chronic, it's because you have 15 plus migraine days a month.
well,
Um, so, and I do. And I can have multiple migraines in one day. Good. If my head's like okay, it hurts a little, then I'll put my migraine glasses and I'll still go to the movies. But if it's pretty severe, I'm going nowhere. Like I'm in my room, my door is closed, everything is dark, you know, the shutters are closed. There's no sound. I have green light therapy that I will put on if I feel like I need that. And then I'll either sleep or I'll with my glasses on and my screen dimmed all the way down with the night shift lights on, I'll read because reading is a pain distraction for me.
a bag that you carry everywhere with you to stop the onset of migraine. So, what is in your bag?
But I have tried a lot of things and there's things that I don't like. I'll still write a product review about it and I'll just tell people like it still might work for you. Like just because it didn't work for me doesn't mean
Mm-hmm.
don't try it. I just didn't like it necessarily, you know?
Your son also has migraines, so lots of stress with your own ailments, and a husband in the military. So, how did you manage to deal with everything? Stress. How did you deal with everything since stress is a migraine trigger?
Yeah, stress is my largest migraine trigger.
Hello, welcome to my podcast, to Mike to Joe Suit. I'm Joe Suit, and I'll be giving a mic to Erica. She's a Latina creator who gets migraine that can be life-stopping. There are different diagnoses of migraines. Erica has migraine with Brainstem Aura, Hemiplegic Migraine, Vestibular Migraine, Retinal Migraine, and new daily persistent headaches. I have a super duper serious question. Is one of the causes to migraines Latinas?
I mean, maybe.
Yeah,
It is hereditary, so, you know, my kids have,
yeah,
my
I hung
daughter
out with a
has it,
couple. Yeah,
my
hung out with a
sisters
couple
have it.
Latinas, and I can see why they drink a lot.
Yeah, we have a lot to think about, and we're overthinkers, many of us. So I don't want to generalize, but you know, we are overthinkers, and we have to get it out of our head. So how else are we going to do that?
Yeah, you got great drinks that taste like non-alcoholic drinks and dangerous.
For sure.
Yeah, just every time I hang out with someone, and it's like when you leave, it's like you gotta take like a deep breath and like
A nap.
decompress.
You have to go take a nap or a hot shower or something. Yeah,
Yeah,
for sure. I mean, I
but
know what it's like when my family gets together. It's pretty crazy. And you get home and your social battery is drained. So, yeah, I get it. We had a family gathering last weekend for my sister's birthday. And at the end of the night, I was like, thankfully, I didn't like have a migraine attack or anything, but I was just drained completely. So
they're
yeah,
they're awesome, but they're like horrible at the same time.
we've been brought up to kind of not say how we're feeling and just take it and don't ask questions and keep your head down. And a lot of us are really strong-willed and strong-minded, but it's a hard balance because like for myself, I never stood up for myself or spoke up for myself. And so if I went to a doctor or I met someone new, things like that, I kind of would adapt to their personalities and kind of mimic that. And that was
Hmm.
easiest for me. It helped me socially. And I still do that to this day because I think as I'm getting older, like I'm 43, I'll be 44 this year, and I'm still learning parts of myself because after being diagnosed and becoming chronic, I lost my career. So with losing your career, you kind of lose yourself if you put everything into that, and I did. And a lot of women seem to do that when they work and are moms and are married. And I honestly, I think it's any woman who puts a lot of effort into what they're doing, like in a job or things like that. So when they lose that, or when I lost it, I lost my complete identity. So yes, I was raised Latina, but like I'm a Latina that doesn't speak Spanish. I don't know very much. And so we kind of were raised a little very American. And I don't know if that was on purpose or not because of the whole language barrier, and you want to be able to speak very clear English and have no accent and things like that. So I don't know. I don't know. It's crazy how a lot of us who are non-speaking Latinas kind of want to fight you all the time because we're already like on defense. We're real defensive. So at least I am. But I'm also like super nice and overachieving and all of those things, and it's super stressful. So yeah, I don't even know if I answered your question, but all of that came out of my mouth. So
Yeah, it's I fear that you had migraine symptoms when you were growing up, and you were cured with food. So what triggered you to get officially diagnosed? Since I know being Latina is a huge contributing factor being diagnosed properly.
I definitely wouldn't say I'm cured. I still have migraine attacks very regularly. Growing up, we ate anything and everything, and I don't even think it had anything to do with being Latina necessarily, but just that we ate a lot of, heavy foods, a lot of carb heavy foods, a lot of oil. Like we call it manteca, it's basically lard. And so that was used in all the foods that were cooked for us.
Hey, you know some Spanish right there.
Yeah, I can say the food words. And so food was just a big deal. Like I am considered overweight, right? And so is pretty much the rest of my family. And it's funny because my mom doesn't have migraine and neither does my dad. But me and my sisters do. My daughter and my son do. I have a cousin and some aunts that do. So it is hereditary in our family, but it's also sporadic in who it has affected. So, but the one common denominator is our food, right? So we would eat Mexican heavy foods, but it would usually use like pretty unhealthy ingredients, at least for my body. Now, I'm not saying food is bad because we can eat foods and be fine. It's just some people's bodies don't tolerate certain foods well. And mine for sure doesn't. I have an issue with sugar. Sugar is one of my migraine triggers. And so when you eat heavy carbs like white rice and, you know, or processed pastas and things like that, that converts to sugar. So it's a real big balance between keeping my sugar levels low and my carbs low. I had to switch from heavy carbs to complex carbs, which would, for me, I eat a lot of forbidden rice, which is like a black rice. And I cook that in Mexican style. So I make Mexican rice using black rice instead. So it's just tweaking all of the recipes that I grew up with and making them with more whole foods rather than processed and high carb foods. Because like black rice has lower glycemic index than white rice. So it's just, learning about food and how to put it together. So now I eat the Mediterranean diet for the most part, like about 80% of my diet is Mediterranean. And with that, and that was because of my liver. That had nothing to do with migraine. I
Oh,
had like
really?
really high liver levels. My liver enzymes were like skyrocketed. And so 3 months ago, my doctor, he was like, you need to try the Mediterranean diet. I want to see you in 3 months. And let's see what happens if you lose 15 pounds. And I said, okay. So I did it. I followed the diet. And I did have like meals that I would consider maybe like not approved or things like that, but sporadically. It wasn't like an everyday type thing. And so
Yeah, I'm not
yesterday,
ignoring you. I'm
actually,
just looking at a Mediterranean diet so I
no,
can.
no problem.
It
Well,
sounds good.
yesterday I went to my liver doctor yesterday, and all my levels were normal, like completely normal in the green. And that was just after losing 13 pounds and eating the Mediterranean diet.
Yeah,
I don't
for
know. I
yeah
believe
for
it's the
every
diet itself,
yeah,
not
just for
just losing
everyone
13.
listening, a Mediterranean diet contains lots of fruits, veggies, legumes, grains, olive oil, and aromatic herbs. Consuming dairy, eggs, and wine in moderation, as well as fish, and only a little meat.
Right. Yeah. So we eat fish, we eat chicken, but I only eat red meat maybe once or twice a month. It's supposed to be once a month, but I am Latina, right? So, I'm a big red meat eater. Like, I love
Yeah, that must have been
hamburgers and
must have been
tacos,
hard.
and yeah, it was really hard actually because I'm real big on eating red meat, and so I
Yeah.
had to stop and just do chicken and just do fish, and so I switched to ground chicken instead of ground beef and things like that. And so the way I spiced it still made it have a decent flavor so that I didn't miss the red meat. And I don't anymore. I have like my signature salad that I created for myself, kind of mimicking the Chick-fil-A salad, the market salad with the apple vinaigrette dressing. I kind of made my own, and now I make my own dressings and stuff. So I've learned a lot. And there's a lady named Alicia Wolf, and she's called the Dizzy Cook. She did a Mediterranean diet for migraine. And so, like, it just came out a couple months ago. And so I got to meet her. She lives here in Dallas. And I got to meet her at her book signing and everything. And so now I have her book and I'm using that. And it's really cool. Like, she uses foods that do not have ingredients that are known as known migraine triggers. Oh, I can't get that out. They're known migraine triggers in some foods, and so she removes all of that and creates recipes for people who are just, trying to avoid migraine if they have those food triggers. I found that I don't really have that many food triggers. Mostly it's like high carbs. And so that's why I have switched to the lower carb foods, but I still eat grains and things like that, the ones that are complex carbs, because those are healthy for you. So I'm not carb free or low carb or anything like that necessarily, but I have still lost weight. And so, like I said earlier, I don't know if it was the weight loss that helped my liver or if it was actually the Mediterranean diet foods because I'm eating a lot of greens and I didn't used to. I eat a lot of salads now, and it's weird because I had to convince myself that it was okay to eat a salad at breakfast because that was so weird to me. I'm used to like high sugar. We eat like in the Latina or the Latin culture, we eat something called sweet rice. Well, in English, it's called sweet rice, right? And basically, what it is it's white rice that's boiled, and then you add milk, cinnamon, and sugar, and you mix all that up. Well, that's like really high carb and really high sugar. So, that's what I was used to eating like that, like really sugary cereals and things like that. So I had to stop doing that. And I haven't eaten those kinds of breakfasts in a really long time, but I've known sugar was my trigger for a long time. And my son, he's 20, and sugar is also his trigger. So he has to also be careful how he eats because of the same reasons. So it's funny when I saw my liver doctor yesterday, both my husband and my son were like, okay, we're going to do this with you. So I'm excited they're going to join me doing this. But really, it was because I was really worried about my liver. We were actually pretty worried about it. I had testing done and blood tests and like so many vials of blood, right? Just to figure out what's happening. I'm doing an ultrasound soon because I didn't have one, but I had some other scans done and, thankfully it was like at the lowest level of anything. There was no permanent
Hmm.
damage. So I've been able to kind of reverse all the things because it'd been a whole year that my liver enzymes kept showing really, really high. And then I did this diet and it's gone. So I was like, what? I was so confused. I was like, okay, well, I'm going to keep doing this. Then my body obviously loves it. So,
So
you
are
know,
you good now then? That's fair to say.
yeah, so he wants to see me in 6 months. I still have to do the ultrasound so that we can look at the liver, just to make sure everything's fine with it. But yeah, my doctor was really excited yesterday. Like he was super happy. And that's kind of weird. I'm not used to that. I'm not used to being like, "Oh yeah,
Good
things have
news.
turned around." You know. Normally it's, "Oh, your tests are all normal, so there's really nothing wrong with you. You need to see the
Yeah,
psychologist."
that happens often. Yeah.
Yeah. Yeah, that happened to me more times than I would like to count. So,
So you say your levels were your liver levels was high, so you went on a Mediterranean diet, and then you lost weight, and then your liver levels went down. So how did it impact that at all with your migraines?
so it's funny because I have I want to say I have the same number of migraine attacks, maybe a little bit less, but I say quality. There's no such thing as a quality migraine, but like the tolerability and the pain level seems much easier to deal with. So I still get my migraine attacks, but they're just
I
more
think the word you're
tolerable.
looking for is
Yeah.
severity. Maybe the severity is
Yeah, the
less.
severity, right, exactly. So the severity isn't as high. You know, I take meds and I do like physical therapy. I'm going to start aquatic therapy soon. I'm doing a lot of things to strengthen my left side of my body because that's what my migraine affects. It's the effects from my head to my toe on the left side. So when I get a migraine attack, like yeah, last night I had a really bad one, and I get non-epileptic seizures when my pain level gets too high. So my pain level skyrocketed, and I had the non-epileptic seizure, and I we had to just let it pass. I mean, my son and my husband and my daughter, they're pros with this stuff. We've been dealing with it for a long time, so like we kind of just waited it out. Really, it's all I can do. And when I was able to kind of come out of it like mentally, because I get like altered consciousness with it. So once everything came back into focus and I was present in the moment, I was like, crap, I need to pee. But I was like in the still feeling everything, you know? So I had to get up. My husband helped me get up and he said, "Can you walk?" And I was like, "I think so." So, you know, he stood next to me. He like guided me into walk, but I couldn't lift my leg. And so I was, you know, I was like, it hurts every time I lift my leg. And so I decided to just kind of drag it to get to the bathroom. And so that's what I did. But it's kind of strange because you go from completely able to do something to completely able to not. And it's just over and over and over and over and over. So it's like having a stroke over and over again. And so it's unbalancing, you know,
Mm-hmm.
because you're just like, it's like a roller coaster.
Yeah.
Yeah.
It
So
seems it's unpredictable.
yeah, and it is pretty unpredictable. It's funny enough though, with this attack, I knew it was coming about 2 days ago. I have like the sixth sense. My body does some weird
Huh.
things. Like I get some tingles in my head, or my eye will start to tingle, like very specifically. And I was like, I think something's coming. So I told my husband this morning or yesterday morning, and I said, hey, just a heads up, for the last 2 days, I've kind of been getting these little warning signs that I'm probably gonna have a pretty serious attack. I said, I'm just letting you know. That way you're not freaking out when it happens or anything like that. He's like, okay. So then it was the evening when it happened, and I was like, I told you. Like I knew it was coming. I knew it was coming. And so yeah, I mean, I've been living with hemiplegic migraine since about 2004. And so I've learned my body pretty well. I know when it's coming. Sometimes I don't though. It just hits. So it is very unpredictable. Once in a while it's predictable, but not really. It's hard to tell.
Well, I'm gonna reference to a big time in your life on April 1st, 2004, I believe. You
Hmm.
were in a terrible car accident, and so it's heavy. You were in a car accident on April 1st, 2004. It took 5 years to get properly diagnosed with migraine with Brainstem Aura, hemiplegic migraine, vestibular migraine, retinal migraine, and new daily persistent headaches. So before the accident, were you just diagnosed with regular migraines, and then the accident exacerbated your illness? exacerbated your symptoms, or what happened?
Yeah, pretty much. So before that, I had seen a doctor for migraine, and mainly it was just head pain. I didn't have any other symptoms really. It was mainly head pain. And usually people consider that as classic migraine. There's no aura.
Mm-hmm.
So I went in and tried medications. It didn't work. And it's funny enough, is she was the first doctor I ever saw. It was my primary physician. And she said, well, you probably need to get divorced because it seems like that's your biggest trigger. And I was like, what? I was like, I'm not going to do that. And the medicine I took was giving me really bad dry mouth. And it was really a medicine for depression. And so I was like, I can't take this. Like, I'm drinking water, like one water bottle after another, and my mouth still feels really dry. So that was this, and it was a side effect of the medication. So I got off of it. And I'm sure I tried other things. I really don't remember now. They happened very sparingly. So it was considered acute migraine because I only got them maybe a couple times a year. And so um, I would take medicine and I would stop. And then if I stopped, they would come back. And then so it was kind of like going back and forth. And I wasn't consistent with medicines or anything like that. It wasn't that bad, I guess, compared to what I deal with now. But when I was in the car accident, it was a really bad accident. And I was bed rest for a whole month. And then after that, I started having these really weird things that happened to me. Like I blacked out, my vision blacked out one day driving down the street. And my husband had to rush me to the ER and figure out what was going on. But I had severe head pain, like I had never felt in my life. So, of course, that's considered an emergency. And I remember the doctor giving me like this cocktail of pain meds. I had all kinds of pain meds, and nothing was hitting the pain. All I felt was weird. That was it. Like I was probably pretty high in the moment, but I was still like lucid and everything because the pain was intense, and I was like, this hurt, like this hurts so bad. So
Does migraine like show up in any test or anything, or is it more of a
not
you
really.
telling him no?
Yeah, I mean there are some cases where things have shown up in MRIs for some
Mm-hmm.
people. They'll show some lesions, but it doesn't show up in most people.
But not you, of course.
Yeah, it didn't show up for me. So, they contacted a neurologist while I was in the hospital bed, and he told them to give me IV gabapentin, and so that's what they did,
Mm-hmm.
and that finally took my pain away. So
Oh,
that's when
really?
they realized that my pain was neurological, and so there began the journey of figuring out what was
Okay.
wrong with me. Yeah, and then things started happening from there. More symptoms started showing up, and then it looked like epilepsy. It felt like someone beat up my whole left side of my body, which when
That's
talking
so
about
strange.
yeah, exactly. When talking about hemiplegic migraine, the left side body or the one-sided body pain, that's not typical. What's typical is not feeling anything. It's paralyzation. Most people can't do anything with their side. It could be left or right, and they feel very numb. And so I would feel numb, but I could still move. And then I started to get severe pain. So I get severe pain from head to toe on my left side, and that's considered migrainous corpalgia. And I just learned that last year that that's what that was called. And it happens on the same side as my headache. And so that kind of trumps the weakness because that's what I'm concentrating on. But I also can't like lift my leg or lift my arm very well. Like if let's say I'm walking to the car, because that's normally how it happens. I'm walking to try to get back in the car. Like I can't lift my left leg, so I either have to use my right arm and pick it up and put it in the car, or somebody
Mm-hmm.
does it for me. So it's things like that. But I also have the severe pain. So I have the muscle weakness, but not the paralyzation. So it's really weird because mine's a
Huh.
little bit different than a typical hemiplegic migraine patient.
So like according to Matthew McConaughey, you're all right, all right, all right.
Yeah, sometimes.
Man, that's crazy how your body is just like just like decide to like, hey, this left side is just not gonna do anything today.
Yeah, exactly. Yeah, it's like, oh, let's take a nap.
Like
It's
it's
just,
so strange. It's like strange how like the brain is like
hmm
the way it works, and it's like I don't understand it honestly. I don't know. It's crazy.
yeah. I mean, I do know that it's the central nervous system. I have a very excitable, sensitive central nervous system. And so I also have fibromyalgia, and
Yeah,
I'm
that's a
being
new one for
evaluated.
you.
Yeah. That kind of is a new one for me. I was like, well, it is and it isn't. I've been diagnosed with it several times actually, but because the majority of my pain has always been one-sided, they would take it away, give it back, take it away, give it back. So I've been
They can do
diagnosed with
that.
fibrom. Yeah, they can do that. I was diagnosed with rheumatoid arthritis once, and they took that one away, and epilepsy, and they took that one away. Because it was just really hard to diagnose the hemiplegic migraine. But I have other issues. Like I have Sjogren's, which is an autoimmune disease, and Raynaud's. And so, I'm being evaluated for, let me see if I can say this right, undifferentiated connective tissue disease. And that's an autoimmune condition. But they're like on the reason it's undifferentiated is because they can't figure out what's wrong with me, basically. Because I have all these separate autoimmune diseases that are normally together with rheumatoid arthritis or lupus or several other conditions, but I don't have those. So it's like, okay,
I
well, you
mean, they
might
share a lot
later.
of the same symptoms, so it's kind of like,
Right. Yeah. Yeah, exactly. So I
uh,
am also getting an evaluation soon for something called POTS because we always thought I
mm-hmm,
had cardiac issues, and so I had a full
yeah.
cardiac, evaluation done this at the end of this last year, and he determined that it's not a cardiac issue. My heart looks very nice, very clean. So I was happy about that. And so he and my migraine specialist were like, maybe it's POTS because like I've kind of fainted and feel really dizzy, and it's not the vestibular migraine. So now I'm going to be evaluated for POTS, which is like, let me see if I can say this one right. Post
You don't have to
orthostatic
say it. It's
something
okay.
something.
I know what you're
Yeah.
talking about. Yeah, I'm pretty
Yeah.
familiar with POTS actually. The biggest indicator is that if you stand up and then
Hmm.
if your heart, if your blood pressure drops while you're standing up, then that's most likely POTS.
Yeah. And so how it happens with me is I'll have a migraine attack or I'll get the migraine attack, and when I stand up it all comes back and I feel like passing out. Like the pain and my migraine pain, I feel like passing out and everything. But the minute I lie down, I feel completely normal. So I'm
Yeah,
constantly
it sounds
like
like
drinking,
POTS.
yeah, and I'm constantly drinking electrolytes because I'm constantly getting dehydrated. So, like, I drink Noon constantly, and I have like the fast hydration version. So I took one of those last night after my attack because I was like, I'm gonna throw everything at this. I put my migraine glasses on, I drank my
Hmm.
Noon. What else did I do? I did a Nerivio treatment. I took my meds in the morning. So like, I have all my little rituals I do for all these different things that happen to me. And they help. Nothing has really cured it, obviously, but whatever helps. And I've tried a lot of stuff. Like I've reviewed a lot of stuff on my blog just because, just trying to get through them.
Yeah, so let's talk about like what is the worst migraine you have to deal with? Like I don't know if I should list them all again for you or
Yeah, I would say the hemiplegic migraine with the migrainous corpalgia pain plus the altered consciousness with the seizure. Like it all happens at the same time. And those are my worst attacks. And it usually takes me 3 days to a week to recuperate from those. It used to. So, like the one I had yesterday, I was recuperated within the hour. But that's because I've like, learned my body and I have a lot of different treatments I can try. And so, like I said, I threw everything out the one I had yesterday. And within an hour, I was almost completely back to normal. So, it took me a while to get there, though, years to figure all this out. Like, in the next one that I could have like that might not respond well to those treatments, and I still might be in bed for a week recuperating. Because there's something called migraine hangover, and the hangover is really rough. It's almost as rough as the actual migraine. So even though you have a migraine for 24 hours, the next 24 hours you're in the hangover phase and you're recuperating, and it feels like a hangover. And it's funny enough, like the things that cure hangovers are what we do during our hangover period after a migraine. So it's like the electrolytes, eating a little bit carb heavy, things like that. So it's funny how it's just very similar, you know,
yeah, I
and it
never heard of
works.
migraine hangovers before. I kind
Hmm.
of think of it as like, like you're sick and like you slowly get better and you just wake up and you're like, oh, I guess I'm normal. You don't really
Yeah.
like see the progression, but I'd never heard of a hangover before.
Yeah, yeah. So a lot of people get that. Some people can pop up in the morning after a migraine and be okay. And then sometimes other people are still in the migraine phase because of the hangover. The migraine pain is gone, but everything else is still there. Like they're dizzy, um, things are kind of blurry still, they have really bad nausea still, and that's still considered migraine. So even though we call it like a migraine hangover, just because the pain is gone doesn't mean the migraine's over. And so once the hangover phase is over, then your migraine's over. And here's another thing too, not everyone gets pain with migraine. It's not just headache. So a one-sided headache is only one symptom of migraine. And it's not even sometimes the biggest issue for people with migraine. A lot of times it's either the nausea and vomiting or the severe dizziness, aphasia, which I get, which is being unable to speak properly. Like sometimes I'll sound like a toddler just learning to talk. In my mind, I know what I'm trying to say, but it doesn't come out.
Hmm.
Yeah. Or I'll stutter really badly and it's very hard to distinguish what I'm saying because my stutter is so bad. But yeah, so it's like a speech issue, vision issue, hearing is really heightened, it's very sensitive, touching, like just doing this could be really painful. So it's a whole neurological event that happens during a migraine. So, and it's not always including head pain. Some people have never had head pain with their migraine attacks. I wish I was one of those people. My head
Oh,
pain's pretty severe, so
I mean, I'm learning a lot right now. I'm just kind of blown
well,
away. It
no,
all
I'm glad to
exists.
teach you. Yeah,
Yeah,
it's
so
a
it's
it's a lot. And if you're chronic, it's because you have 15 plus migraine days a month.
well,
Um, so, and I do. And I can have multiple migraines in one day. I can have like maybe two attacks in one day, like one in the morning and then one in the evening. I mean, you can have more than one if they end quickly.
so are
And if
you
somebody
good right
tells you,
now?
right now I'm good, yeah. Like I woke up good, I'm still good. I have my ring light on, which I wouldn't be able to do if I had a migraine attack.
Mm-hmm.
So, it's just I can go to the movies if my head's good, if my head's like okay, it hurts a little, then I'll put my migraine glasses and I'll still go to the movies. But if it's pretty severe, I'm going nowhere. Like I'm in my room, my door is closed, everything is dark, the shutters are closed, there's no sound. I have green light therapy that I will put on if I feel like I need that. And then I'll either sleep or I'll with my glasses on and my screen dimmed all the way down with the night shift lights on, I'll read because reading is a pain distraction for me. I kind of just go on vacation mentally and the pain's all still there, but it is a good pain distraction for me. So,
Since you deal with 15 migraines per month, so let's talk about what you carry in a bag. So you mentioned that you have a bag that you carry everywhere with you to stop the onset of migraines. So what is in your bag?
so in my pouch that I created for myself and I eventually put on my shop, it's just this little pouch and it fits in my purse really well. So in there is my abortive medication, which is Nurtec. And then, do you hear all that? My cat's food's being dispensed. It was pretty loud.
Oh, yeah, I was wondering what is that. I don't have a cat.
My son's cat, he has an automatic feeder, and so it just gave him his lunch. So, okay, so in my bag is my Nurtec, which is my abortive, and I just like put that under my tongue, and it can work pretty quickly if I take it right away after I start to feel symptoms. And then I also have mints in there because I like to use peppermint. It helps kind of soothe my stomach if I'm nauseated. And then I also have like this nasal inhaler by Migraine, and I love it because it's really strong peppermint scent. And so if I am somewhere, because I have a really sensitive nose, my husband calls me a hound dog. So like let's say we're at the mall and we're passing past Bath and Body Works or something. I can't go there. Like I can't. It's triggering. Like I can smell it and get triggered. You know what I mean? So I hold that to my nose if I'm going into somewhere like that, and I'll just like sniff on the peppermint, and it helps. I don't have to smell everything else. So I definitely keep that everywhere I go. I have my migraine glasses that I take everywhere. My son uses them. My daughter uses them. and they're called Avalex glasses and I stand by those 1,000,000%. They are, I've tried many types of migraine glasses, and those are the ones that have worked the best for me. So, another thing that I should have brought my pouch out, but I don't know where it's at. It's probably in my purse. I have my electrolytes in there, my Noon, that I take everywhere with me because, like I said earlier, like I'm always getting dehydrated, and
Mm-hmm.
dehydration is one of my triggers, and so I'll take one of those quick. As soon as I start to feel symptoms, I'll drink that. And if I don't have that with me, then I'll kind of make a DIY version with like my salt and lemon and all these little other things that I put in a drink, and then I'll drink that down. The other thing that I have in there is gum. Oddly enough, like if hunger pains seem to be a trigger for me, and I can't explain it, and it could be a sugar thing. I've never really looked into it, but if I keep gum in my purse, just like the act of chewing and kind of the sugary and the calories that I'm getting from the gum seem to help. So the gum kind of helps with this odd, but it does help a little bit with that. So I'll chew the gum until I can get actual food in me. And then I think that's all that's in my purse right now. Oh, and I have an essential oils roller from Migristil. It has like peppermint, lavender, eucalyptus, stuff like that. So I'll put it here on my temple and like on the side of my jaw because I'll get like pain all here too. Like it goes into my teeth and everything. So I'll just put that essential roller there because like the scent of it, I don't know what it does. I don't know if it just like soothes me or what, but it kind of helps me to just relax, like decompress. Because when I get a rapid heartbeat, that's also a trigger for me. So trying to just like zen out really helps bring my pain level down. I mean, not like a whole bunch, but getting my heart rate under control, it helps with that. So I don't know. I just have found all these little things, all these little hacks to try to bring things down. I wish I could fit. Okay, so I have this thing called the headache hat, and it's this whole thing. It's like a helmet for your head that's nothing but ice packs. So I put that on when I have an attack. But because I can't fit that in my purse, in my little pouch, I actually found these little, those old time head pouches with ice in it and stuff, like those blue ones that like you see in cartoons and stuff. Okay, but you might just be too young to remember. But it was like this ice pack, and it was blue, and people would just hold it there. So I was at the store and I found these little mini ones. This one was pink, but I found these little mini ones that you could put ice in and put on you. So
Oh,
I have
I know
that
what
in my
I know
pouch.
what you're talking about. If you're sick or something. Okay, yeah, yeah.
Yeah,
Okay,
exactly. So I
yeah.
found one of those, and it's really small. It's like this small, and I
Mm-hmm.
put that in my pouch. So now whenever like I'm at a restaurant or the store or something, I can now just put ice on me by going and getting some ice and throwing it in there. So that's what I've been doing. So that's what's in my pouch.
Yeah, the last 10 minutes just sounded like a whole ad.
I know, right?
Oh, it's yeah. So like you mentioned it before that like you review a lot of products. So does gonna guess that some products work for some and some work for others, and the only way for you to know is really to test it on yourself and see if it works for you.
Yeah, exactly. Like, I'm really sensitive as far as my body goes, like with medications and trying things, and I'll get side effects to everything. And so I try everything first before. So yeah, I try a lot of products because I'm so sensitive to side effects and things like that. I have to try everything. And I used to be afraid of trying things because I was like, no, because I'm going to have an attack if I try it.
Mm-hmm.
And I already had like made up my mind that it was going to be bad for me. Eventually, I got past that and just started trying things to see if it would help. Like, obviously, I'm not going to try something that's dangerous necessarily, like, a product that's dangerous really, or something that I just don't want to put in my body, right? But I have tried a lot of things, and there's things that I don't like. I'll still write a product review about it, and I'll just tell people like it still might work for you. Like just because it didn't work for me doesn't mean
Mm-hmm.
don't try it. I just didn't like it necessarily. And I only like put my name behind something that did work for me really well or worked for someone else that I trust really well. So, like, I won't ask for a coupon code or anything like that if it's something I don't believe in. So, if I'm giving people coupon codes for products, it's just because it really worked for me and actually made a difference in the quality of my attacks, like the severity and the tolerability. Or I found that it was really easy to use and it made me feel good, like mentally. So like the essential oils, it helped me to relax. So that's why I like to use them. Like the migraine glasses, they actually help my attacks, almost like medication. So, I mean, pretty much like medication, honestly. It's a really good preventative. I use them when I'm on my computer for too long and I know it's probably going to trigger me. So I'll use them preventatively, things like that. So, yeah. But I am willing to try pretty much anything. I even tried this one product where it doesn't go over the head. You hold it in a stick like this, and it's got these Ys. It almost looks like a stethoscope, but it's got these little knobs here, and you put it on your temples, and then you like twist the cap here, and it tightens. And so it's like pressing on your temple, and you just like massage your temples with it. Is the best thing ever. And I'm like, I don't even know if this is safe to do or not. But I'm constantly going like this, or really it's just on one side, but I'm constantly
Yeah.
like pushing my temple in to try to make the pain go away. So, I mean, it's just one of those things. I've bought so many things on Amazon to try. I mean, like neck massagers and different kinds of compression and just so many things to try. There's so many products out there. So not everything works and everything, and a lot of things are made pretty cheaply. So you just have to try. There's so many hacks out there and a lot of them just irritate me. They're like, oh, you just need to drink more water. And it's like, it's not that simple. People drink water. I drink a lot of water and I'm still going to have a migraine attack. I have to make sure I get electrolytes because that's where my dehydration seems to feel better with the electrolytes rather than just water. So that's what I mean. Like there's a lot of things and some people are like, oh yeah, like put your feet in cold water and do something with your neck at the same time and then your migraine will
Mm-hmm.
be cured. And it's not like that. I still do the ice on my head, but I had one person tell me one time to take a really hot shower and then suddenly make it cold because it shocks your system and it like resets and all this stuff. And I was like, okay, I'm going to do that. So I got in my shower, turned it on super hot, which was amazing, and turned it to super cold real fast. I had such a severe hemiplegic migraine attack right after the cold hit my system because it basically shocked my central nervous system into a severe attack. And I was like, I will never do that again. Like, I will never do that again. So it's like you have to be careful what people like suggest to you. They have the biggest hearts and they just want to help you and they learn to something that might help, but you also have to trust yourself and your body. And if something doesn't seem right, be careful. Be careful with these like home remedies and stuff just because you could actually harm yourself. And that's my one big takeaway and my one big giveaway for people who are really desperate and trying to fix their attacks. Like it is a biological issue. It's really, there's no cure for it. So I know some people feel like they're cured because they started eating a certain way and removed all of these things from their body and now they're cured. Well, no, it's because you had to modify your whole life so that you didn't trigger them. And I bet you if you ate whatever you removed from your diet, it would come right back. So, it's that whole thing. Like you're not necessarily cured. You've removed the triggers. And, that's just pretty much how it is.
I mean, food does seem to be a trigger of some kind that does actually help or limit the severity of things.
Yeah. Yeah. For some people, it really does.
So let's talk about your parenting. So I have here that your daughter has migraines also, and she has migraine-associated vertigo. In addition to hormonal migraine, your son also has migraines, so lots of stress with your own ailments, and a husband in the military. So how did you manage to deal with everything? Stress. How did you deal with everything since stress is a migraine trigger?
Yeah. Stress is my largest migraine trigger. And mostly it's like financial stress, marital stress, and parenting stress. Those are the biggest three stressors in my life. And so a lot of it had to be dealt with in therapy. Therapy was really big for me. Initially, when I was first diagnosed, I had doctors telling me that there was nothing wrong with me and it was purely psychological. And so that really put a bad taste in my mouth for therapy because I was like, no, there is something physiologically wrong with me. And I had several doctors tell me the same things. I had one doctor like yell at me like a trainee. It was at when my husband was in the military and we saw military doctors. And I think he was a colonel and he yelled at me so badly. I had gone in there, my blood pressure was wacky. I was feeling really badly. I was in the wheelchair that day. And he was yelling at me as if I was a trainee in boot camp that there's nothing wrong with me. I was ruining my husband's military career, that I must have some really deep, dark secrets that I was hiding because it was affecting me physically. And I started to hyperventilate. I was crying. My husband, he was, I want to say he was an E3 and was like in shock that this was even happening. Like shocked and silence. And he was just like, didn't know what he was looking at me, looking at the doctor, looking at me. And he's like, just like in shock and didn't move and say anything. And I looked at him and I'm like, get me out of here right now. And he rolled me out. I was hyperventilating out the door, bawling. And when we got out of there, he was like, I'm so sorry I didn't say anything. He's like, I don't even know what to do right now. Like he was scared. Like like he was like, I don't know what to do. And I was like, I'll never go to him. I'll never see another military doctor ever again. I said, because that like ruined my experience, right? But what I did see a neurologist there, and she also kind of had the same thought process. And I think that's where he got those thoughts from, honestly, because he read her notes. But she did send me to a clinical psychologist. And so I went to the psychologist because I was just over it. I was over people telling me there was nothing wrong with me. And I'm like, okay, you know what? I'm going to see a psychologist and we'll go from there. Let's see what she has to say. If it is all in my head, then fine. I need to figure out how to fix this because I'm done with these attacks, right? So I see the clinical psychologist. We do several sessions. And at the end of our time together, she says, there is definitely something medical going on. She goes, this is not psychological for you. She said, there is a psychological component, whereas stress is a big trigger for you. She said, but there is something wrong physiologically. She's like, I highly suggest you go to a migraine specialist or a migraine center or something like that, where that's all they treat. She said, because you have a very complex case. And I said, okay, hemiplegic migraine is considered a rare condition. And I've been told, oh, you're too young to have that, or that's too rare. There's no way you have it. I've been told those things. So I did. After I left her, I immediately made an appointment at the Mayo Clinic in Arizona. And that's where they agreed that there was something wrong. It wasn't purely psychological. And now I can appreciate the fact that there are conditions that are purely psychological. But you have to like really make sure that there's nothing physically wrong before you accept that, And I'm glad that I kept pushing and didn't just say fine, because I wouldn't have the treatments and anything today. I would still be bedbound every single day. I had migraine every day. I was in bed every day. So that was like super chronic, right? Like that's really bad. No quality of life whatsoever. And now I actually have quality of life. And so I'm thankful for that. But it takes a lot to get to that point. So going to therapy, after that, I started seeing a regular therapist pretty regularly. And that's what's helped me learn the tools that I've needed to get through stress. Like I've learned how to bring my heart rate back to baseline when I'm having anxiety. And I never had anxiety or depression before chronic migraine, oddly enough. That was never an issue for me. And it was for my husband. He has generalized anxiety. And so I knew those things when it came to him. And I never dealt with that until my migraine became chronic and I lost my career. And then it started affecting every aspect of my life. So learning how to cope with all of those different things has been really important. I've learned how to communicate. Like with my husband, we've learned how to communicate with each other. It's not perfect. We fight like any other, married couple. But we have learned how to communicate with each other. With my children, I have learned, not 100%, but I have learned not to be so empathetic with them, because like I don't know if it's a mom thing or if it's, I don't know what it is, but I feel when they're hurting, when they have attacks themselves, when they're really sad. Like my daughter has social anxiety, and when she gets really bad, when she used to get really bad in high school, and it would break me, and I would have attacks because I was so stressed, because I just want her to be happy, right? So
Mm-hmm.
I would take on all that stress onto myself. It was like I felt what they were feeling, and my mind, my brain like multiplied it by 1,000,000%, and I did it to my own self basically. So I had to learn how to bring down that empathy and let them figure out what they're going to go through and how they're going to deal with it, instead of me trying to rush in there and save the day. So that's hard. That's hard for me. But that was one of the things I have to kind of like remove myself from some situations so that I don't feel that stress. And it seems kind of heartless, but my therapist promised me, he's like, it's
Mm-hmm.
not selfish. It's not heartless. You're there for them as a mother, but you also have to protect yourself, because then you can't be there for them if you're
Mm-hmm.
constantly being triggered because you're so stressed out for what they're going through. And I was like, okay. So it's kind of like the whole airplane thing, like put your mask on first before you put your mask on your child type thing. So I was like, okay. So I had to really work that. I had to really work on that. It was hard. It's still a struggle to this day, but I'm doing it. It's hard. But I mean, daughter's 22. She's graduating from college this year with her bachelor's degree in psychology and family studies and some other things. And my son, he's 20, and he's taking a break from school, but he is also in college. And he was like, I need the semester off, mom. Like, he was getting really bad migraine attacks from stress himself. And, he lives with ADHD. And he's also on the autism spectrum. So he was just like really, his social battery was just drained. And he was like, I need to take a semester off. And I'm like, I'm all for it. Like, do not do something that is detrimental to your mental health. And so he's taking the semester off. And yeah, as a mom, I'm like, oh, don't do that. You might
Yeah.
not finish because you're doing that. But I don't want him to feel like I'm not supportive. And so that has been a little bit of a stressor for me, trying to find that balance of being a supportive mom, but also helping him to still rise up and level up, because he's still so young. And so, yeah, it's a constant balance of, I can't get too upset. I can't get too happy, because then I could trigger myself. Because it's not
Mm-hmm.
just negative stress, it's also positive stress. And I mean, positive stress is what I mean, like when I get really excited about something or I'm really happy about something, it's like I teeter totter in emotions. And if I'm not like this, if I go too high or too low, I'm triggered. So I have to try to maintain that middle line. And it's hard. It's really hard, especially when I'm easily emotionally triggered. So yeah.
Yeah, so how do you like differentiate from, like, so let's using your son as an example, how do you differentiate of pushing him to be a better person, but also allowing him to deal with that? Because I feel like if you can't handle college, it will be hard to like handle life outside of that. Because like if you have a job, you can't really just stop having a job, but you need to make it. So how do you differentiate from you should push yourself more versus maybe they are dealing with too much?
Yeah, and that's the hard part, because like I'm dealing with it right now. Like he just told us towards the end of the semester that he didn't want to enroll in spring. And I was at first against it, because I'm like, no, because then you may not go back, right? Like,
Mm-hmm.
but then I had to sit down and really think about it. I had to put it into perspective. I was like, okay, my son's not neurotypical, right? So
Mm-hmm.
I have to kind of like put my mind in his head and see life through his eyes, because I don't want to push him so hard that he falls. I still want to be able to have like that safety net that's like really low, so that he has the opportunity to learn, because that's how he learns, by his mistakes. So he's got to learn that a decision has a consequence, and either way it goes, you're going to learn from it. You're going to learn if it was a really great decision or a really bad decision. And so I have to try to allow him to make those bad decisions sometimes. And I don't think this was a bad decision though. I thought it was in the beginning,
Mhm.
but the more I kind of did my own research and looked further into autistic and young adults with ADHD and how they learn, I realized that this might be exactly what he needs. He might need to refocus himself so that when he goes back to school, he's more able to concentrate and focus. And he did tell me, because he's untreated for ADHD, and he has been since he was little because he has a really bad side effect. He's like his mama. He gets side effects to everything. So he was like, I want to try meds and see if that will help me so that I can go back to school and be able to focus and concentrate. And I'm like, okay, I think it's a great idea that we try to do this now while you're out for this semester. Try a couple of different medicines if that's what it takes, 2 or 3 if that's what it takes, and see what he feels helps him the most. Like he's going to find a job, like that's his goal. He did sign up for like DoorDash, so he's going to DoorDash for now until he finds a job he wants and things like that. But he's very high tech. He knows everything about TVs, everything about computers. He built his own computer. So I know he has skills. And my former life before chronic migraine, I was a cybersecurity consultant for Department of Defense as a contractor.
Mhm.
And I have built computers. I've learned programming and things like that. And he's kind of following in those same footsteps, but he wants to work in gaming somehow, either in animation or level design or something like that with gaming. But it has the programming component, it has the graphic design component, and so we are very similar people. So like I'm constantly looking things up for him, and I'm like sending him links. I'm like, look at this one, look at this one. And I told him, I was like, son, you don't have to go to college. Like you don't have to go to college to be successful. I was like, you can totally go and get certified in something and do what you love. I said, when you work in tech, you don't have to have a college degree. Yes, you'll probably get paid more money and, higher positions down the line. I said, but I don't have a college degree. I got certified in cybersecurity and I did very well for myself while I worked in that field. I made very close to 6 figures and I was working my way up. I was in my early 30s and doing very well. And I know that if I was still in that field today, I would probably be a supervisor and I would probably be making way, mid 150s or $200,000 a year doing what I did, but it didn't work out that way. So I know that, but in my own experience, I know he doesn't have to go to college if he doesn't want to and still be successful. Like there's so many avenues to success. So I'll just be there to help him figure it out and let him make those decisions. And he tells me, like, he's pretty straight up with me, Mom, like, this is what I want to do. And I don't want to do it your way. I want to do it this way. And I'm like, okay, okay, I'm
Mhm.
sorry. I said, but if you do have questions, I'm right here.
Mhm.
And so
I wonder if I wonder if he's dealing with autism burnout.
I think that's exactly what it was. I know that ADHD and autism do have some overlapping symptoms and things like that, or not necessarily symptoms, but experiences. And he's definitely going through because he would tell me he would come home and he's like, my social battery is completely drained, and he just felt like he could breathe. And I remember when he was little, he would come home and he would be like, well, my friends told me that if I stopped acting like this, they would stay my friends. But if I continue to act like this, they wouldn't be my friend anymore. So I'm just going to act like that for them. So I don't, so I have friends. And it broke my heart, but I understood. He was masking. That wasn't a word back then. But we know it now as masking, and that's exactly what he does. And I think he still does that to this day. And so it's exhausting. It's exhausting for him. So I think he truly needed to step away and he needs to find his people, you know, and stop trying to hide who he is to make other people happy because it causes migraine for it. I don't say cause. I should not say causes. It's not a cause of his migraine, but it's a trigger. Um, when he's really stressed, he gets pretty triggered and it's either sugar or stress for him. So he knows his triggers. He's learned them very well, and he didn't start having them until late high school. It's 11th grade, I think. He had gotten COVID. We all did. We had gotten COVID, and then he started having them more regularly. So I have a feeling it has a lot to do with COVID also. So
Well, I know a couple of autism people that I can definitely hook him up with for you guys, and you can just chat about and share your experiences. I feel like you
yeah,
need
that would
the
be cool.
autism component to you to help.
That would be cool.
All
Yeah.
right, so before I take the mic away from you, is there anything you want to say, promote any words of wisdom, the winning lottery numbers? The mic is all yours.
I wish I had some winning lottery numbers because then I would use them. But I think I would just say that if you experience migraine attacks or headache and you don't understand because so many other things are happening at the same time as your head pain, more than likely it might be migraine, and really seek out a headache specialist rather than going to a general doctor, just because they will have that knowledge that you will need so that you're not told, oh, it's probably psychological or just take Tylenol and things like that, or it's just a headache. Migraine is so much more than the headache component, and sometimes you won't even have the head pain. So that is my word of wisdom. And you can always contact me at achismile.com or on my social media, which is Achy Smile blog and Achy Smile shop. But I'm always there. I'm always online. I'm always on social media. Once in a while, I'll take social media breaks, but it's not
All
often. So
right, thank you, Erica, so much for giving me your time and expertise. Thank you, everyone, for listening and watching, and I'll catch everyone next time. Bye.